Welcome back to Tales from the Road with Dr. Jill Windy. I'm Dave Dufour, and we're talking about periodontal disease and teeth and the very important and bad breath in your dog. And you know, and we're laughing about it, but can get pretty serious, and you can lead to a pretty miserable life for your four-footed furry friend. Right. There's enough F's in that sentence, I think.
There you go.
And I think that you know, it's something that everybody needs to know about. That that pets do need some dental care. You know, sure, we didn't do that when we were all kids way back in the olden days, but like you said, you had more physical problems with animals because we didn't do that. Right. So, and you know, healthcare improves for all of us.
That's
so, what do we do for animals with this problem?
Well, the very first thing we're going to do is we're going to have a physical exam, because there's more to a pet than teeth. So we have to get the whole picture, know what's going on, and we also need to you know, assess at least what we can see in an awake pet, how bad their mouth might be. And then we need to do some preliminary things to make sure that anesthesia is going to be okay, because we do have to anesthetize these guys to get to their mouths effectively. So we have to make sure that they're going to be safe to do that. And by and large, with the degree of monitoring and the types of drugs we use and the preliminary testing that we do to address problems, we're going to, you know, make that a very, very safe procedure too.
Okay.
But yeah, got to have the anesthesia part. So we'll get the preliminary testing. With the anesthesia, we really need to be able to get to every single side of every tooth. We need to probe down the gum line. We need to take dental x-rays. They are the little x-rays that fit inside your mouth, very similar to the ones when we have our dental x-rays done. So, you know, you can't like hand them a bite week and say, hold this. So they have to be asleep. So we do the anesthesia part. And very, very important that you have, that you check with your doctor, that you have one person who is monitoring the anesthesia and one person who is doing the dental procedure. Because very, very important that you divide those duties out, because you can hook them up to all the bells and whistles, but if you wait for the alarms to go off, you know, you're kind of in crisis mode at that point. Whereas having someone whose only job is to watch them while they're asleep is obviously the direction, you know, we want to go as far as safety concerned.
Yeah, so, well, that's same as with human medicine.
Exactly.
You have a surgeon who is not also the anesthetist.
Exactly.
There you go.
Exactly.
That's all right. Good.
So
now, let me ask you this: are the animals like full? Is it a full anesthesia that you use, or is it? Can you actually do more of a tranquilizer kind of thing, so they're semi-awake and it's okay, or is it just not
No, it's
safe?
a full anesthesia. Yeah, and you know, you're sticking your hands in there. So if you'd like to do a second dental that day, you need to, you know, not get bit.
Yeah, or maybe for the rest of your life.
Right.
Yeah.
But no, they really need to have a full anesthesia. It's actually less stressful in their bodies to have a full anesthesia than to be partially awake and not know what's going on. And also, very, very important part of this is when you're doing these cleanings, you're going to have, you know, there may be a little bit of blood in the mouth if you're doing an extraction or have really bad gingivitis. There's going to be water because the instruments that we use, you know, I mean, they have all those little suction things like when you're getting your teeth done.
A lot of liquid floating.
Well, when you're half asleep, you can't protect your own airways for that. So all of our dental patients have to have a tube that goes down their throat, just like when you have a gas anesthesia. And whether or not we're on a procedure long enough that needs gas or not, they're always having oxygen through there. But yeah, they're going to be on a gas full anesthesia.
Okay. All right. So then what's the procedure basically? You're doing it's a dental scaling essentially. That's one of the things that you do?
Well, that's one step. That's one step. The first thing we're going to do is we're going to examine the mouth fully. We're going to look for lumps and bumps. You know, teeth aren't the only things in a mouth. So we need to check and make sure there aren't problems elsewhere, like growths or tumors or abscesses or draining tracts or whatever. So we're going to assess the mouth first. We're going to clean all of the teeth with a dental scaling, ultrasonic scaler, and that's going to remove all of that plaque and tartar and stuff off of the teeth. We're going to go ahead and I think we actually have a picture of that.
We have a picture of the procedure, I think, yeah. So
so there we are. So there we are getting working on a little kitty there and doing the scaling. And you can see we've got, you know, I've got the goggles on there because that stuff kind of kicks up a little bit. Heather's leaned over working on some monitoring there for us. So we're working on this little kitty.
She must like the smell.
Yeah. She's got her mask on. But we're going to get that scaling done, get everything all cleaned out. Next, we're going to probe around all of the roots, and we'll show you what that looks like too. Some of the things that we may find around there. Now this is what we call a furcation exposure. So on our teeth that have more than one root, where those roots split is called the furcation.
Gotcha.
And cool doctor word of the day?
Furcation.
Furcation. And what's happening there is that probe is actually going sliding along under that gum line between those roots, and you can see the other side of the probe out the inside of the mouth there. So this tooth is one that's going to end up having to go. So you can see it's all cleaned and ready, but with that degree of bone loss, that tooth can't stay in there.
I see.
So, and that is something you may or may not find on an awake pet, because that's going to be all covered up with tartar, you know?
Right, right.
So
Now if you left that tooth in there, it's going to break off at some point anyway. Is that what is likely to happen, or does it cause more? It cause more damage when it does that?
It could break, but what's going to happen there once we get that degree of bone loss? There's not enough to hold that tooth in. And it becomes the tartar cave. So
Gotcha.
it's just a perfect place. It's trapped up by gum tissue, and there's a big cavity, not a cavity like we get. There's a big hole in there that's just going to trap stuff and just keep it all going like a little incubator.
Right, okay.
So we can't go with those.
All right.
The other thing we might find, maybe we find a pet with a broken tooth. And we'll actually see some pets who will have a problem, and we'll actually see the pulp is exposed.
Okay.
And there's one right there where the probe's actually just going right up into the pulp cavity. So
Wow.
imagine doing that on an awake pet. So we've got that we might have to do. After we go along and we probe and we do everything, we're going to need to take some dental x-rays, because we got to see what's going on up under the gum line where we can't see. And this is super important for cats, because half of the problems that they have are below the gum line, and we don't know they're there until we get the x-rays. So here's an example. This is actually, I think, that fractured tooth, and we can see it's actually got bone loss all around the roots. So you see those kind of darkish gray balloon things around the bottom of the roots there? That is supposed to be nice and white bone, like the rest of the stuff up there, but it's being eaten away by an infection up there. So that's a tooth root abscess.
Okay.
So that guy's got to go.
Okay.
Sometimes we'll see some really loose teeth on an exam. We think, oh, this is going to be great. These teeth are really loose. It's going to be nice and easy. They're going to pop right out of there. Well, you have to take your dental x-ray before you do any extraction, because there can be reasons for those teeth to be so loose.
Right.
And one of the reasons we can have those are tumors that are in the jaw. And this is what this looks like. So there's no bone holding those teeth. They're like floating in space.
Right.
But there's this huge bone tumor that's coming off of there, eating away that bone.
Now that's that is calcium bone.
It's actual bone. Yeah.
But it's grown up.
Bone tumor.
But it's more. But it's obviously less dense and less
right.
less solid in terms of a bed for teeth, obviously.
Yeah.
So right.
So it's eating away all that stuff, and while it's growing.
And it probably doesn't feel good.
And it hurts pretty darn bad.
Yeah.
And you might look at this pet, and he's got a little swelling under his jaw, and you think, oh, it's probably just got an infection from these nasty teeth. If you don't take that X-ray, you're not going to find that, and that's obviously going to drastically change the name of the game there.
Yeah, that's bad.
Now,
okay.
Kitties are special. They write their own rules, as anyone who owns a cat knows.
Right.
But they get a special problem, extremely rare in dogs, but very common in cats, called an oral resorptive lesion. And this guy is so cool. Look at that nasty. So the tooth, either tooth on either end of that picture have these resorptive lesions.
Right.
And they are literally being eaten away, and they go right through the pulp cavity.
Yes.
Very painful. You can have a cat on general anesthesia, and you go along and hit one of these with your probe, and it hits the nerve that's in the pulp, and so they, their teeth chatter.
Right.
But don't know what makes them start, which is the really cruddy part. So we don't know how to prevent them.
Right.
But we haven't found a definitive cause and effect for those. But they're extremely painful, and we really just have to get them out.
Okay.
Because they just progress no matter what we do.
Right.
So
okay.
those are ickies.
Icky.
Yeah.
Okay. So what other treatments? We have treatment. Other extractions is probably the primary when you get so far along, right?
When you're getting out to those stage 3s and 4s, some of those teeth we just can't save, so they got to go. Or you got a resorptive lesion tooth like we saw. One of those, they're going to have to go. So extractions are a big part of, unfortunately, what we have to do for those later stages of periodontal disease. They can eat without those teeth. It'll be okay, I promise. They do okay. In fact, they'll probably eat better now they don't have this like chronic infection and pain in their mouth.
Right. Yeah,
so
that's the thing. Eliminating the pain really helps them a lot.
Oh, yeah, absolutely. So, and we're going to have this... and it really is a surgical procedure, because you got to go in and move some of the bone, and you pull the roots out, and then you have to sew over, and excuse me, and then we'll actually see what that looks like when they're all when they're all completed.
Okay. Do we have a picture of that here?
Yeah, we do.
I think we have a photo of the extraction.
We have one of the extractions and the
there
stitches.
we go. Oh, there we go.
Yeah.
I see. Oh, so yes, right.
So this is a big canine tooth that had to be taken out. And canine teeth are so cool because the root is longer than the crown. So it's big fang teeth. They got even more root than what you can see in the crown.
Right.
And they're curved.
Right.
Because they're supposed to stay in the head, you know? So when they have to come out, we actually have to go in and make this big flap in the gum and then move the bone and pull this big root out. And we have to suture that all closed. So that's what this picture is a post canine tooth extraction.
Wow.
But sometimes we need to just make flaps because we need to go down and clean a pocket and put an antibiotic pack in it, or we need to, do something along those lines. So we don't just pull teeth. And for some pets who are in that very early stages of periodontal disease that we saw in segment 1, they actually just need to have under the gum line cleaned out, and that is their treatment.
Right. Now you use fluoride and polish and that kind of stuff after you do this.
Yeah, yeah.
Okay.
You have to use the polish because another similarity to our human dental partners is after you scrape that off and get it scaled off and everything, you're going to leave some little tiny edges in the enamel. And if you don't go through and polish those smooth again, they're actually going to allow tartar to accumulate faster than it did in the first place. So you have to go through and polish those like that.
That's cool. Okay. Well, when we come back, we're going to look a little bit more at things that you can do to help prevent some of this stuff, because I imagine that prevention is
early treatment
better, like almost everything else. Right. Yeah. Take care of your dog, and your dog's teeth won't bite you or something. I don't know. Anyway, so
they'll be much happier.
Right, they'll all be much happier. So we're going to talk a little bit more about what you can do, and in cooperation with your veterinarian, to keep those choppers healthy. We'll be right back on Tales from the Road. Got a question or a comment for Dr. Jill Windy? Get in touch at tales@rvnn.tv or leave a voicemail at 877-578-RVNN, extension 705. Hey, why not email a photo of you and your pet on the RV trail? We love pictures, and we might just use it in an upcoming episode. Follow RV Newsnet on Facebook and Twitter, and you can receive text messages to alert you when we're streaming live by texting RVNN to 72727. That way, you can join us live in the chat room, ask questions, and become part of the RV Newsnet family. Remember, any photos or other material submitted to us become the property of RV Newsnet and cannot be returned. Today's show is brought to you by Angie's List, where you'll find thousands of unbiased reports and reviews about service companies in your area. Whether you're looking for a roofer, plumber, house cleaner, dentist, or even a doctor, Angie's List members share their experiences with each other so that you can choose the service company that's right for your job. Companies can't pay to be on Angie's List, and the reviews come from people just like you who have had experience with the companies mentioned. To find out more, go to rvnn.tv and click on the Angie's List ad.